Bev, we can start with your question first. So just for context, Bev launched a couple of months ago, getting some referrals trickle in, not so much luck with Psychology Today or directories, had the first initial call, but the patient didn't end up scheduling the initial free consultation. And then as this happened a couple times where patients are reaching out via email or via the contact form, but not actually scheduling the free phone consultation. So I went back and reviewed your website and in the whole structure and flow, and your website's perfect, your structure and flow is perfect. So I can't imagine that people are coming to your website and contacting you via your contact form and not having seen your fees. So let's go specifically to this person that you talked to. You said you had your first initial call. So this was a free 15-minute call that you did. And then how did it go?
Yeah. It went pretty well. The only question she had was a little bit more clarification because she was currently on Lexapro and it'd been a year or so and it wasn't working for her as well as it used to. And then she did mention she was having panic attacks. So I'm thinking she wanted, to change medication. So I gave her an idea of, the holistic approach mixed with Western medicine and let her know that, I'd still want to see labs and, rule out anything medical that was causing it. She seemed receptive. I genuinely think she does have an upcoming appointment with another psychiatric provider. Hopefully, she'll get back to me. But what I ended up doing after the call was I tried to hold back and not send her a synopsis email, but I just went ahead. And I was like, okay, here's the next steps. We'll schedule an appointment if you decide to go with me. And then, just wishing her luck.
I would think that was a nice thing to do, to send a follow-up email. It's the kind of thing that in the coming months you might not have the time or bandwidth to do, but in the beginning, when you have more time, you don't have a lot of patients, I don't think there's a harm to kind of doing a little bit of extra effort to get your first patients. So I wouldn't read into that situation too much. I mean, that sometimes happens where you do the phone call and they don't end up coming into your practice. But let's think more about why. It sounds like there's also a handful of people who went through your contact form and then just never scheduled a call. So tell me a little bit about what those interactions, I presume over email, what those interactions were like.
So generally though, in the comment section, give me an idea. I'm looking at my little referral summary. One person was saying they were perimenopausal, had more than 20 years of diabetes treatment. Now, I'm not sure. I don't know if they thought that they were on a PCP's website or if they were actually saying that they had some mental health comorbidity there somehow. But I just sent the templated format email letting them know, I don't take insurance, but here's the link to my website so you can take a look at my fees. I have some time available, next week. Feel free to schedule the initial call for 15 minutes on this form at your convenience, and then radio silence. So that's generally the situation. Okay,
because you make it very clear, I don't think you could do it any better in your website, where to get to contact you in the request a consultation page, you have to check that it's out of pocket and I've seen the fees. So it seems like it would be hard to imagine patients aren't looking at your fees, although it's possible. People just check this and then don't actually look at your fees, because that sounds a little bit like what's happening. If someone's seen your fees and reach out to you, there's no reason that they wouldn't want to take the next step and schedule a phone call unless they missed the fees, and then you essentially reminding them makes them realize, oh wait, I didn't realize that's how much it costs. I think that was probably what's happening, is that even though you make it pretty obvious, sometimes people miss it. Here was what my thoughts are. I've kind of two ideas for you. One is I want to talk about your marketing strategy overall from a 30,000 foot view and kind of other things we can optimize. But also when I saw your fees, I think that it might be strategic for you to lower the cost of your intake only. Because if you think about it, their fees are totally reasonable, and I think you could get patients to pay those fees, but sometimes the intake becomes a hurdle that it's hard for patients to get over. And ultimately for you, you're only seeing patients for an intake once. It's not so important how much you charge for that intake. You really make money on the follow-up appointments after that. Even though the intake is a ton of work and certainly a person should charge more, it might be strategic for you to lower it so that patients just can get over that initial hurdle and get into your practice. And then raising your fees is more of a strategy when you're getting too many patient inquiries and you kind of want to slow that process down a little bit. So I would consider, I think you had asked in your forum post, should you follow up with those people who kind of ghosted? And I would say yes. And I would say like, hey, just checking in, I didn't hear back on my last message. I was wondering, did you find another provider, or perhaps cost was the limiting factor? And ask the question. And if they reply and say, yes, cost was the limiting factor, say like, you know what, I totally understand. I work with people in this situation. I'd be willing to waive half of my intake fee. Would you be able to do that? Or is that something you'd be able to consider? And see if that makes a difference.
Okay, I'll give it a try. Thank you.
So tell me about what you're doing overall for marketing. I know you put in the message you had gotten some traction with therapists. Are you networking with other people besides therapists?
I originally was like kind of just emailing like functional medicine practitioners, naturopaths, a couple therapists before, but that wasn't like generating the response rate that I was hoping for. There's a therapist I used to work with, and she clued me into a local Facebook group that a lot of them are part of. And it's really active, and they're sharing referrals. So from there, like I ended up finding like just this community of North Texas therapists that meet once or twice a month, and they like to meet in person so they could get an idea of each other's vibe, because you don't want to blindly refer and then like have it burn you if it's a bad match for the patient. So I think I'm cool with that group. So hopefully.
Yeah. That's excellent. And I'm wondering, because therapists can be good referrals, but the downside with therapists is because they're seeing patients for weekly therapy or every other week, they typically have smaller patient panels. So you just need a network with a higher volume of therapists to get enough referrals. But I wonder, since you're kind of getting close with this group, one, is it just therapists that go to their networking things, or do other psychiatrists or psych MPs go?
So they mentioned one other psych NP going, but otherwise there's no other professionals, just LCSWs, LMFTs.
I wonder if I would maybe try to network with the other psych NP who is in that group, and then even asking the therapist what other psychiatrists or psych NPs they've referred to in the past, and see if those are people you can network with. Essentially, I think a very high yield group of people to network with is psychiatrists or psych NPs in private practice who are full and already have referral sources and need somewhere to send overflow to. Because they may be getting 3 referrals, 4 referrals in a single week, whereas a therapist maybe will have a patient to send you every month, couple of months, or something like that. Since you are getting to know them in person, maybe just like in casual conversation, just curious, I kind of want to network with other psychiatrists or psych MPs in private practice in the area. Do you know anyone? Who have you referred patients to in the past? For them, they're going to be busy, and you want to more reach out to them like, hey, I would love to, I'm new, starting my practice, would love to ask you some advice. I'm willing to pay for your time. I would love to bring you lunch to your office. I'd love to bring you coffee, be super uber respectful of their time, be willing to pay for it. But like an hour of doing that or 30-minute meeting, you might get a whole bunch of referrals, especially if you're doing it face to face. Like you said, they get to know you, and then you're going to go to the top of their internal food chain of who they're sending their overflow patients to.
Okay, yeah, that makes sense. Thank you so much.
Okay, let me go to Pat's question, I think you had messaged about wanting to cover postpartum depression from an integrative perspective. So essentially, postpartum depression is very similar in terms of integrative approaches to depression, just regular depression, with a couple of caveats of being extra careful about things that are going to be passed into breast milk and could have a negative impact on the baby. So being a little bit more cautious with some of the supplements or herbal medicines in particular. Like vitamins and nutrients are generally fine, but with herbal preparations, some you want to be careful of. But I would also say another core thing is to really help the mom preserve sleep. So I can talk a little bit about that, but just out of curiosity, is there a particular patient that you have in mind, or kind of more curious from a general perspective, Pat?
I have a possible patient. I just had a consult with her, and she has a 3-month-old baby, and she's not sleeping. She's feeling sad. She's crying a lot, but she doesn't want medication at all. I haven't seen her yet. She's on schedule for next month.
And is she reports being depressed? I mean, I know you haven't seen her, but was this like an initial phone call that you had with her, or like an email interaction?
She has some of the typical depressive symptoms. She's crying a lot. She's irritable. She feels sad, and she's not enjoying her baby. She's not
enjoying the baby.
Not enjoying the baby, but she has no suicidal thoughts or thoughts of hurting herself or the baby. But she's just like, I should be having more fun with my baby.
Okay. And what's her reason for not wanting, or I'm sorry, what was that?
Doesn't want medication.
What's her reason?
She said she's never taken medication. She actually doesn't believe in medication. And I asked her if it's, something that she can consider if she continues to feel the way she's feeling. And she's like, I don't think so. She said the reason why she called me, she read through a lot of profiles. Mm-hmm. And she said she was attracted to mine because I said I would do the neuropsychical as well as therapy. Mm-hmm. And she thought it was a good way to get both of those, that instead of just going to a therapist. Mm-hmm. So that's really basically all I know.
Okay. This is how I think about a patient like this, because remember, even though we're integrative providers, we also want to save patients from themselves if they are resistant to what is ultimately in their best interest. Now, of course, they have the right to make decisions for themselves, but often patients who have a black and white thought process around medication, I'll take any supplement you recommend, but I'm not taking medication, are coming from a place of misconceptions or fear and anxiety, or also just not understanding the pros and cons of medications versus other approaches. Because absolutely, in a postpartum woman who I am going to presume is breastfeeding, the safest, most studied treatment for postpartum depression is SSRIs. And there is so much safety data, not just in breastfeeding, but in pregnant women. And obviously the exposure to a baby when you share blood supply with a baby is much higher than in breastfeeding, where only some of the drug is getting into the breast milk. And there's massively large registry studies with tens of thousands of women who have been in them showing that SSRIs are extremely safe, versus there is not any studies like that when we're talking about some herbal and plant-based medicines. It's a lot of them are probably safe, but also just not studied. And I imagine part of the reason she wants to not take medication is because she doesn't want to put her baby that she's breastfeeding at any risk. So here's kind of how I would approach it. I would kind of throw her a bone, meaning that I wouldn't start being too pushy about the medication thing, since she's coming to you saying she doesn't want to consider it. So I would start with helping her get sleep and just doing supportive therapy and seeing if she gets a little bit better, and then if not, having the medication discussion be on the back burner so that you can bring it up. Say like, hey, we won't talk about medication now, but if these approaches don't work, let's talk about medication. And I would also say maybe doing some lab testing from a functional perspective, just checking B vitamin status, checking vitamin D status, checking TSH, stuff that maybe other doctors haven't gone to in as much detail with her, I think will help her feel you're really really addressing it from a root cause perspective and not just skipping to medication. So I think that will help build rapport, and obviously optimizing vitamin D, optimizing B vitamins will help the depression, any kind of mood symptoms. From a nutraceutical perspective, fish oil is extremely safe, and I would recommend fish oil 2 grams a day of like an EPA dominant fish oil, like an ultimate omega. And then, so with sleep, I know obviously there's like limiting factors to someone who has a newborn to getting good sleep. But what, you know, when I did Women's Life Clinic at UCLA, the reproductive psychiatry clinic, and we would really talk to new moms about what can we do to preserve so you can get at least 6 hours of uninterrupted sleep. So does that mean you're pumping, or that your husband, if she's married, is like formula feeding in the middle of like doing the nighttime feeding so that she can sleep? Or is there family that can help, or hired help? Is that something accessible to her? But at least having her partner, if possible, help with the nighttime feeding so she can not have to do a middle of the night feeding. Sometimes in women with more serious symptoms, like more severe depression or like bipolar disorder, this doesn't apply to this patient, but just speaking more generally to people, we would have conversations with women like, you maybe shouldn't breastfeed because it's more important that you sleep, or you might have a psychotic episode if you're not sleeping, like for a woman who's bipolar. I don't think that applies to this person, but just for context. And also, you're describing symptoms that certainly sound like postpartum depression, maybe not severe postpartum depression, so I think it's reasonable to consider non-medication options first. But in the first session, say we're gonna start with this, but here are the reasons why I really believe medication is safe, explain like the registry studies and everything, and let's just have in our back pocket to have the conversation open about medication in the future. Are you open to that? Kind of leaving it open, not pushing it the first appointment, but ultimately that would be what she would need, or what would be best for her if it comes to that point and these other approaches aren't working.